Hey, this is Juan with West Texas Strength, and I had open heart surgery. About a month or so, I made a post on Instagram and Facebook, just kind of showing something that happened, but with really no explanation. So, the point of this video today is to just give a little bit of a background of what happened leading up to the surgery. So, it's a real quick overview, and then I'll continue on to just kind of go into more detail in the following videos. My surgery took place on June 9th this year, 2022. So currently a little over 2 months post-op, and I'm now back to training 100%, but of course just managing the training load at that time. So what happened? How did this occur? Open heart surgery is a pretty big deal. So what went on? So it started back all the way in February. So we were actually attending a powerlifting meet. After the powerlifting meet in February, I think it was the second week, I got sick, and along with my wife and a few of our lifters that traveled as well. So normally for me, I don't tend to go to like urgent care or the hospital. I don't get sick very often. So usually when that does happen, I kind of wait and let my body kind of do its thing. So I thought I was, like I said, I got sick. So felt like the flu. So, waited a few days, went ahead and got tested, negative for COVID. So like I said, it was the flu. And then from there, I ended up, taking about a week or so off from the gym, and training my clients and stuff like that. So then the next week I came back, felt a little bit better, tried to pick up training. Then by that weekend, I kind of started to feel bad again. Not terrible, but just not normal. So the biggest thing that I experienced, or the biggest symptoms that I've experienced during that time, so from February leading up to April, most of it was fatigue. So I felt more tired than normal. Like I said, just felt a little bit, felt weaker. I still kind of trained as much as I could based on how I would feel. My first thought was, I'm feeling a little bit more tired. I've been working a little bit more. Let me go ahead and just dial back on work, and let's get a little bit more sleep. So, in a week's time frame, I improved my sleep from, 4 to 6 hours to 7 to 9 hours per day. So after a week or so, I noticed it didn't get better. Then I started to get like a headache. For me, headaches are very rare. And it was more kind of in the back of my head. So I thought it was maybe a tension headache. Spoke to one of my clients, one of my physician clients, and we kind of talked about that. Kind of went back off and on. I still haven't gone to get another checkup to see what's going on. Then I started to think about maybe it was what we're discussing was maybe like a long haul COVID. So something that was kind of going around is that once you had COVID, maybe I thought it was a false negative, that it can take a while to recover back 100%. I had a few of my clients experience that, and like I said, I've seen a few cases of that. And so I thought it was the long haul. So I was like, okay, well, I'll wait that out and see how things go. So that turned into about a month or so. Then on week 5, we traveled to another powerlifting meet. Again, I was symptom free, but again, I just didn't feel like I had energy. So just to kind of put that into perspective, if you look at a battery, maybe charged at 100%, I felt like I was operating at like 50% the whole day, and then by the end of the day, I was approaching 0%, and then I would kind of recharge maybe back to 50%, and then and went on. So we're traveling powerlifting meet, and this is around March. Then by the end of the powerlifting meet, then I started to experience some more symptoms. I had fever, body aches, just didn't feel very good. So that weekend, the Sunday, that was a Saturday night. Sunday we traveled back. I went ahead and checked into urgent care, looked into my my symptoms. Didn't really do a whole lot of work there. They did some blood work, and surprisingly my blood work came back pretty normal, for the exception of one marker, which it's a CRP, or C-reactive protein. Just kind of a broad, a general understanding of that is that's just telling you that you have an infection. Doesn't tell you really where, but that your body's kind of fighting off an infection. So that came back. So then I followed up with a at the time I didn't have a primary that I haven't seen in a while. So one of our members was a nurse practitioner, followed up, did some more tests. Then saw a little bit more in terms of blood work. Now, for the most part, it was normal. So what the explanation that was given to me, like I said, I'm not following a typical signs or pattern in terms of blood work that would show that I'm having some kind of a specific sickness. So we were going to have to do further testing. But based on a few things, like I said, that CRP, we kind of started pretty broad, and then started to kind of bring it in. So some of the things that I was possibly dealing with was gout, lupus, leukemia, some of those things. So kind of my thoughts there were, crap, some of these are pretty dang serious. If I was going to choose out of the three, lupus, leukemia, or gout, I was preferring gout, of course. But that's something that I didn't want to deal with long term. However, with gout, most of it can be controlled with medication, and then a lot of it's going to be nutrition. So that one I felt I would say the most comfortable with dealing with, because I would think out of the three it would be the easiest to do. So we kind of started a general treatment. I started to take the prednisone pack, so something that's going to give, you've probably taken this before, it's a steroid pack that gives you a 6-day course, and it gives you instructions of when to take them during times. So we fast forward, and that actually I was on day 4, and at that time I was me and my wife were actually going to brunch with some close friends, and when I returned back from brunch, I decided to work out. I completed my workout, chatted with a few of the members, and then my wife then, I learned this after the fact, I actually ended up losing my memory. So she told me that after my workout, she asked how my workout was, and I was pretty adamant about that I hadn't worked out yet. So that I was going to get ready to do that. And then because our gym does have a 24-hour surveillance, she ended up pulling up the surveillance to show me, and I still wasn't sure that I had worked out. So what ended up happening is she called one of my clients, instructed her to take me to the emergency room. So then that's where I ended up in the hospital about the first week of April or so. And that was about a 10-day visit. So for the first 2 or 3 days, I don't really remember a whole lot. I got a whole bunch of tests. Again, this is after the fact. Someone telling me that this is what happened. Chest x-rays, CAT scans, MRIs. I ended up having a spinal tap done, echocardiogram, a bunch of other stuff, and to test to see what was going on. And at one point, the thought was that I had some meningitis. So I was kind of in and out there. Most of the procedures, I kind of knew that they were happening, but I would forget about them in that sense. So from there, like I said, I was thinking it was meningitis kind of when I was more aware of what was going on in terms of why I was there. I knew where I was at. I knew I was at a hospital. I knew that I was probably sick, but I just didn't know why I was there. And I honestly felt perfectly fine. while I was there and even while I was in the emergency room, but my blood work and vitals showed different. Now, it turns out it wasn't meningitis, which maybe would have been preferred at the time. But with the echocardiogram, they ended up finding that the infection actually spread to my heart. So then I found out I was actually born with an abnormality in my heart, which seems to be common, which is a bicuspid valve, just meaning that our normal valves are tricuspid valves, and a bicuspid actually increases the chance of the infection actually staying there, and it turned out to be strep. Strep kind of hung out in my valve, put a hole in it, so now I had what you call aorta insufficiency. I wasn't in any, I want to say grave danger. I was, because now kind of looking back at that and a few nurses and doctors talking to me, like I said, it was a pretty close call given that I was taken to the emergency room at the time. Now, we got everything figured out. They ended up putting in what we call a midline, so it's kind of like a semi-permanent IV into my bicep to start the antibiotic treatment, which required me to it be by infusion, which the infusions, I had 6 weeks worth of daily infusions. So every day at a certain time, I would go into a clinic. They would set me up with antibiotics. This was about a 30-minute treatment, and I would do it for 6 weeks until the infection was gone, and they monitored that. So the first step was they had to get rid of the infection. And then from there, we would plan our surgery. Now, I did have some dental work that needed to be done, which they think is the cause of why I got the infection. But going into the hospital, I had no infection or abscess or anything in my mouth. So they were still unsure of why how the infection happened. So it happened to be strep that caused it, and that led to needing to have my aorta valve actually replaced. So now we fast forward, and the surgery got scheduled for June 9th, which was a Thursday. And my surgery, I checked in about 5:45 a.m. and I want to say surgery started about 7:30 or so. And then I think, again, I don't really remember a whole lot, just for the fact that I was sedated through all this, leaving or getting out of the or into my room, ICU room, about lunchtime, maybe a little bit before. Now, I know leading up to the surgery, for the most part, after the visit in the hospital in April, I think I got out April 12th, I was able still to work out. So I did my workouts normally. I was training 4 to maybe 5 days a week, training clients, kind of doing those things. The biggest restriction was that the training load, I reduced it to anywhere from 30 to 50% as far as total weight. And it might have been even lighter than that, just because I really hadn't been training. The last time I trained with any kind of weight was probably in February, the week of the meet, or that Friday of the meet. And that was like my last deadlift lower body session that I had, that was with, my numbers based on my last maxes. So again, it was light. I was just trying to get moving. But the week up leading to the meet, I started to realize that there was probably a bigger issue, of course, because the surgery was coming up. But then that's when I started to notice the issue, insufficiency being more active, or actually my heart being more insufficient than it was before. So my day-to-day activity was pretty normal, but I would notice by in the evening, I would go to bed pretty normal, but then I was starting to wake up around 2 or 3 o'clock in the morning. It was just to use the restroom, but then I noticed that my chest was really heavy. So it felt like somebody was sitting on my chest. My breathing was pretty hard. So what I ended up doing, at first I thought it was maybe some heartburn, which heartburn is very unusual for me. I don't have any of that, so I'm not limited on any kind of foods or eating before bed, but I thought it was heartburn. So what I would do is I would end up sleeping sitting up for about an hour or two, and that feeling would kind of go away, and then I would go back to bed. But as I got closer to surgery, it ended up being I was waking up every day around that time, and I was having to pace back and forth in my house for about 15-20 minutes to get blood flow going, so my breathing could actually return back to normal. Then I could get about a nap in before I came back to the gym and started to train clients. But as long as I was moving, I was pretty good. But if I stood still during, of course, while I'm sleeping, in the middle of the night, my breathing and discomfort just definitely increased, which, you know, one of my thoughts was when it first happened is like, crap, I'm gonna have to go into the ER and they're gonna have to do some type of emergency surgery. Now, I didn't want that because I wanted to be on scheduled, so I didn't want. Not to say that my surgeon wasn't going to be capable of. I mean, this is things that they're trained to do. They're you know, they've gone through school. They've done, you know, plenty of surgeries, and luckily in San Angelo we have a really good cardiac team. So not that I was concerned, but I would like it to go. I want it to go to according to plan. I didn't want him to have to wake up kind of in the middle of the night or whatever it was. You know, I'm not really 100% sure how they handle those situations, but I wanted everything to go as planned, as accordingly, so I could go as smooth as possible. And that was in my head. Of course, my wife thought otherwise, but I was in my mind. I was like, I can hold off for 2 or 3 more days and to get this surgery done. So that's kind of catching you back up to what happened prior to the surgery, and then now I'm going to be posting more about the recovery process and kind of how I feel, kind of the mindset towards that, and then just kind of moving forward from that. So guys, if y'all have any questions, I want to say concerns, but if you have any questions or about this or just in general, drop the comments below. Please subscribe to this, as we're going to start to push out more content on our YouTube channel to help you and everyone else out in this realm of training, nutrition, fitness, cardiac health type stuff. So really appreciate it, and y'all have a good day.